Hi, I'm Lisa Prather, and welcome to The Voice of Health with our host, Dr. Robert Prather of the Prather Practice, where lives are changed every day through the natural approach to healthcare. Today we're going to talk about how to live younger. How to live younger.
So with the advancing of the years, we actually turn back the clock.
Very good. And that is something we can do. I bought you a magnet for Christmas. Do you remember what it read? I was going to pull it off the refrigerator, but if I didn't know what age I was, what age would I be?
Yes.
You know, what age do we feel like?
And there is a big difference on that. People can be at 60 and feel like they're in their 30s, or they can be in their 30s and feel like they're in their 60s.
Yeah, and it can depend on the day.
It can depend on the day.
Well, let's talk about the difference between chronological age and biological age. What are the differences?
Well, chronological age is pretty easy. It's the year that you were born and how many years you've lived. Mm-hmm. So chronological age is very easy to figure out. The interesting part is there's something called biological age. And your chronological age and your biological age may not actually match up. One of the interesting things is, according to science, biologically we die at about the age of 160. Mm-hmm. Because scientifically that's how long we should live. Everyone should live, on average, all creatures should live 10 times the age of puberty. Mm-hmm. If you actually look at your dogs, they live to be about 12, 14 years. They reach sexual maturity at about 12 to 14 months. The mayfly reach sexual maturity in a day. They live 10 days. All the different creatures out there actually will live 10 times the age of puberty. And the average on that for humans is about 16 years old. So we should, on average, live to be 160 years old. So when we're talking about biological age, one of the things is people usually, for every chronological year that they live about 2 biological years.
Okay. All right. And when, you're talking about that biological age, people, 160, I mean, that people aren't living even
close to that.
Close to that.
Right.
Right. And I know you've talked before is how quickly we reach that 160.
Right. And there are ways to actually measure out one's biological age. One of the things that is very, very evident on that is that even sometimes different organs can actually age at a quicker rate. So, trying to keep as young as we possibly can. And as we actually measure out biological age, I myself am measuring, I'm going to be 57 this year. Mm. But when I actually do my biological age, I'm at about 36.
So how is biological age determined?
Well, biological age, you can actually measure that on different organ systems. The most important biological age is your lungs.
Okay.
And the best way to measure that is a spirometry. And
that's a lung function test.
That's a lung function test, and that's the most scientifically proven and evaluated and accepted means of actually determining a biological age, which we can do at the Prather Wellness Center. That will actually give you probably the best estimate of how long you will live and where you are in your whole aging process. There are other aspects that you can actually measure for biological age. Your glomerular filtration rate is a good indication of how old your kidneys are.
And how do you determine, is that through blood?
That's a blood test. So how well, and we've got people who are in their, we had one person, 72, and they had 20-year-old kidneys. Mm-hmm. And we've had people who were in their 30s and they had 110-year-old kidneys. So, there's a big variation on that, and one system can actually cause a decrease in one's life expectancy. Your nervous system easy way to do a quick measurement along those lines, one very scientifically definite ways of measuring your nervous system, is just, are you able to stand on one leg? Mm-hmm. And how long you're able to do that. And you can actually determine your biological, neurological age from that. Your flexibility.
So that's balance and
right.
nervous system.
There's
Flexibility,
There's a skin test, how loose your skin structure is. So there are many different types of ways to actually do a set of biological age determinations. And they can actually give you a good picture of where you are. And you can be very young in one area and very old in another.
Do they even out?
There is a way, there is mathematical formulations, and there are different ways to actually do a full biological age test. But if you have one system that's going down, then that can actually cause premature death. So, looking at that, evaluating where your biological age is one of the most important things. And one of the things that we see on people is as soon as I do a chiropractic adjustment, especially the Atlas adjustment, oftentimes I tell people afterwards when I recheck them on their nervous system, I tell them I just took 20 years off of their life expectancy, off of their age. Mm-hmm. Because oftentimes right before that they couldn't stand on one leg, and immediately afterwards they could.
So the effect it has on the nervous system
is immediate. Mm-hmm. So, there are many different types of ways that you can actually approach that. And as you can get those things under control and get them working correctly, then you can reverse people's aging process.
Now, you said at the Prather Wellness Center, you can evaluate some of the biological age through...
I actually always do.
And that's through the lung function test that we do?
Certainly. There's heart evaluations, there's lung evaluations, we do a whole set of blood tests. We look at the liver, kidneys, the pancreas. The immune system is actually a good measurement of how old you are. The flexibility, how loose the skin is, all those different types of aspects goes into a total picture of how old you are. And one of the things I'm constantly looking at is, as we can get someone closer to homeostasis, the younger they become. Mm-hmm. So the more that you are out of homeostasis, the older you are. Your endocrine system actually plays a very big role on that too, a huge role actually. So all those different types of factors that we do evaluations on all go into the total picture of what your biological age is. And then as we can make improvements in each of those areas, you actually reverse the aging clock. Yeah. And not only live longer, but also add more life to your years too.
Right. You're saying we should be living to 160. Why would we want to, people might be saying out there, why would we want to live that long?
Well, when you're talking about living at that age level and actually be able to be functioning, I'm talking about someone who can go out there and play golf, have sex, mm-hmm. Very mentally sharp. Mm-hmm. There isn't the brain deterioration. There isn't the joint deterioration. It's someone who's in their 160 who's acting like a 50-year-old. Mm-hmm. So if people are thinking along those lines, then that's a totally different type of picture. Mm-hmm. So you can actually do the aging and have your health and well-being and your activity.
Well, how does disease care and structure function care play into longevity? We talk about the differences here on our show. So how do the disease care model and the structure function care model play into longevity?
When we're talking about structure function, we're talking about homeostasis and achieving a balance in people's lives. As you achieve that balance physiologically and structurally, that plays an extremely important part on that. And 80% of all healthcare should actually be in the structure function model. And that's where you actually achieve your health and wellness. However, there are times where the body is not able to take care of a problem, emergencies, those types of things. If people were having a heart attack or some serious crisis, the best way to actually approach that is through the disease care. Because the disease care is based upon pharmaceuticals, which are poisons, and those are the best ways to make a immediate, quick change in some type of cascade that's occurring in someone's health that can cause a crisis and cause death. So, you can't throw out either one of those. But what we are lacking a great deal in the healthcare system is the structure function model. The disease care model, we have the best in the world. And with that, we can achieve quite a few things, but if you leave out the structure function, then we have all the problems that we have now.
Okay, well, up next, let's talk more about how disease care and structure function care play into longevity and what is the biggest barrier to longevity. You can win a free 60-minute massage in a relaxing spa at the Prather practice. Each month, we have a drawing to give away a free massage to one of our lucky Facebook and Twitter fans. Follow us on Facebook and Twitter on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice. Dr. Prather, what can a new patient expect when they come into your office?
The first thing is that's extremely important is the consultation. That's really where everything begins.
And that consultation is complimentary free. They can come in, and the consultation's with you, which is nice. Yeah,
the consultation is absolutely critical. Matter of fact, you can get 90% of your diagnosis just from the consultation.
Listening to the patient.
Finding out what their concerns are, what needs to be done, how we can best help them. Having a good understanding of the complaints of the patient is absolutely critical for good care, and the patient knowing that we are actually listening to them. We have very thorough intake forms that are extremely helpful. Gives us quite a bit of information of what's going on into the system. After the consultation, you have to look at the diagnostics.
Okay.
You first have to understand, where the patient's coming from, have an idea, but then you have to know, what to do, what the problem is. There is a difference on our diagnostics than from the medical diagnostics. The medical profession, as a disease care-based program, they are looking at disease states and combinations along those lines to treat the symptoms. Our basis of our care is a understanding of what is the underlying cause, finding out what that is, usually caused by a break from homeostasis. And you're going to hear that word if you're listening to our radio program.
You're going to know
every
it well.
Time. Because homeostasis is the basis of our practice, and homeostasis is the basis of health. And we are a health office. That is what a structure function office is. So the diagnostics are extremely thorough, probably more thorough than what you would get anywhere else. We look at very extensive blood work. We might do hair analysis, might do some evaluation of the gut because that's so important to one's health. We do a thorough cardiac evaluation. We do a thorough musculoskeletal exam. Many offices that even are into natural health are either just dealing with the functional aspect or they are just dealing with the structural aspect. We are unique in that we deal with both, and both of them extremely thoroughly and extremely well.
Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope. You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, the most comprehensive wellness center in the Midwest. Before we went to break, we were talking about, how to live younger, and a magnet that I gave you that we have on the refrigerator is if you didn't know what age you were, chronological, if you didn't know your chronological age, what age would you be? And that's just something I want to think about when I open the refrigerator every morning, And but there are tests we talked about that can determine your biological age. But we're talking about, how does disease care and structure function care play into longevity?
Yeah, and as I was explaining on what structure function care is, it's achieving of the homeostasis, both physically, structurally, muscles, bones, ligaments, all those types of things. There is a perfect balance that is involved with that. There is also a perfect balance within the function of the body. If we're looking at the physiology, there is a perfect level that you should be at on each of the different types of measurements. And so as we look at that and try to achieve that, that is one of the areas that our healthcare system is really lacking at this point, is a good thorough evaluation of the structure function portion of the system. Again, our disease care model is the best in the world, but we see that we are spending more than any other country, and we're having much poorer results. Now, the reason is because we have an imbalance. Mm-hmm. Just like there's a balance within the body, there's a balance within healthcare. Mm-hmm. And our healthcare system is completely out of balance. It is completely a disease-oriented type of model. And as a disease-oriented model, you can try to improve that model and change it and play with it. But you're always going to get much poorer results because it's an imbalanced model. So as we're talking about the healthcare crisis and all the problems that are associated with that, with the extra cost, the whole solution for the Obamacare, if we don't take into consideration that we have an imbalanced system, then we're still going to get more of the same results. Mm-hmm. It's not that we have to improve on our disease care model. We need to actually add in structure function model, and that should be 80% of the healthcare system. 20% should be the disease model. And with that, we have a perfect balance in our system.
It should be the first place people go to,
It should be, and that should be something that people are following up with, making sure that they have at least once a year appointments to have a good evaluation on their structure function care. Mm-hmm. And if they did that, then we would have much, much less of a problem with our system.
Yeah. Get checked, get updated blood work, thorough blood work.
And mm-hmm. evaluated not in a disease model. Mm-hmm. Because this is for the majority of medical doctors, they are very good at the disease model, but they haven't really been trained in the structure function model. Mm-hmm. And so having someone who has a good understanding of that is an important type of aspect of your healthcare system.
And you always say have a doctor in the structure function model and one in the disease care model. It's very important.
Absolutely.
Mm-hmm. Well, what is the biggest barrier to longevity?
Well, the biggest barrier to longevity through the experiments that I actually respect is Dr. Hans Selye actually won a Nobel Prize for his evaluation of stress. Mm-hmm. And stress is the biggest killer. So, as we can avoid stress, and I sit there and I say, now I'm going to write you a prescription to no more stress in your life. Mm-hmm. And everybody, of course, laughs.
Right.
But stress is absolutely the biggest killer in America. And of human beings. If you actually, Hans Selye actually did the experiments where he actually stressed animals and then actually measured the changes that took place and tried to reproduce the amount of stress that humans actually normally live under. And he found that as the stress would increase, the immune system would drop, the endocrine system had certain types of changes that would take place. The digestive system would have failures. Just the normal types of things that we think of as aging. And aging is actually a result of a accumulation of stress in our system. So if we can actually handle stress and deal with that, then we can actually have a much better longevity and actually see a lot of the changes that take place with what we would consider normal aging not taking place.
Well, we talked about that a couple weeks ago, with stress, that we need some stress in our life.
And there is actually a definite balance on stress. Again, that 80-20 principle.
Right, it motivates us to do things, but it's when, it's how we handle it, correct? What we do with it. And
in our modern society, I mean, one of the things that we have is basically the stress response as if a tiger's approaching. It is the big thing that I always like to think about. And if that tiger's approaching, the last thing you want to do is take a nap and digest your food. What you want to do is be able to, put all the blood into the muscles and have your endocrine system ready, increase the blood pressure, all those different types of things, and be able to either run away or fight. And if you aren't able to do those things, then you actually have, then you kind of get stuck in that loop.
right.
And people can't, oftentimes the tiger is nowadays not something that we can go out there and beat up or that we can actually run away. We actually have to live with them. So when that occurs, that stress accumulates and then we get stuck into that system. We never actually go into a relaxation mode. So, and a lot of that is actually controlled by our mind. But one of the things how do we control stress? And you actually do quite a bit of work with people on that stress area.
Right.
So, what is it that you do?
Well, the deep breathing is the first thing, because, so many people stop. Well, they start breathing from their chest and the lungs, and it tightens everything up. Sure. So teaching them diaphragmatic breathing from the stomach, and we're learned to tighten our, bring our stomach in, especially women,
Sure.
And so I teach it like an exercise, and people have to practice it at home, because it's so foreign to people.
And one of the things that an easy way to actually measure how bad that is in your life is going up to a muscle called the levator scapula, which is right up at the base of the neck, right in the shoulders.
He's poking on mine.
And we can feel the tightness a little tighter on the left than on the right. And that's a great way to actually measure how stressed you are. And what we do is I actually show people, because they said, I'm just real tense in my neck, and they're aligned in their cervical spine, which is always very important first. But as we evaluate that, I sit there and I start having them do the diaphragmatic breathing, and they can actually feel the muscles relax up there. And one of the things that we do in our office is trigger point injections into the muscles. And the most common muscle that we have to trigger point is the levator scapula, which is the stress muscle. And as we can inject those in, sometimes people have been so tense in there for so long that there's no way that they can ever actually relax it. And if they can't ever relax that muscle, they can never really relax enough to actually do the deep breathing. And they're always in a tense type of a mode. So as I had one patient who, they were just tighter than a rock. We actually injected them and said it's the first time she thought since she was 13 that she could actually relax her shoulders.
Wow.
So, and she could just feel a whole difference in her, because I'd been training her how to do the deep breathing, and she actually couldn't.
Right.
So, there is actually a very strong relationship, not only in so many different ways, but even between the structure and the function of the body. If you are structurally off, then functionally it's very hard to actually operate.
Okay. Listen to the Voice of Health Radio on your smartphone or tablet on all of the top radio apps available. TuneIn Radio, Stitcher, and iHeartRadio. You can find these apps and more on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. Laughter is the best medicine.
Richard Simmons, see, there's one of the reasons why health food never caught on, man. They had the lamest spokespeople. They had John Denver for grape nuts, Wilford Brimley, the Jolly Green Giant. These aren't exactly the manliest of men here. The worst is the Quaker Oats man. Now, oatmeal's supposed to be one of the best things you can get your kids to eat, but their mascot's somebody you wouldn't let your kids talk to. It's an old dude wearing a powdered wig and man stockings. If you saw him on the playground trying to talk to your kids, you'd be calling up Chris Hansen from Dateline. You'd be like, what's that in the bag? It's oatmeal. Like, get out of here, creep. Oh, I was going to make breakfast. Bet you were, sicko.
A special message from the DTS Weight Loss Center at the Prather Practice.
Are you tired of making the same weight loss resolution only to end up right back where you started? Let the professionals at DTS Weight Loss Center take all the frustration out of dieting. Our nutritionists and wellness coaches know what works for every body type and can develop a plan specific to your needs throughout your medically supervised program. Make the change by visiting us online at dtsweightlosscenter.com. Dedicate, transform, succeed.
When you call the Prather Practice to schedule your appointment at our DTS Weight Loss Center, mention the Voice of Health radio show and you'll receive a free initial consultation plus a free body composition analysis. 317-848-8048. That's 317-848-8048. The DTS Weight Loss Center at the Prather Practice. Dedicate, transform, succeed.
I was feeling so bad. I asked my family doctor just what I had. I said, doctor.
I'm Lisa Prather, and you're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where we get to the root cause of your health issue. We're talking about, how to live younger. And last segment, we talked about stress playing such a role in our health and really, for many people, just killing us and making us old.
It does, and of course we're going through the whole Obamacare requirements, and so we've got a lot of stress going on.
Yeah,
right
anybody
now.
in healthcare.
Yeah, everybody in healthcare is just kind of going through all this, and it's a very stressful time in many different ways.
Mm-hmm. I forget how many different laws have been added and to taxes, and it's just a lot going on right now. Well, let's talk about how does chiropractic help? I know you said one of the things that determines biological age is our nervous system.
Absolutely.
And chiropractic's very helpful, and you can see changes immediately in the nervous system.
The main reason, people have injuries and those types of things, but the main thing that causes problems for people and why they actually require the body work, chiropractic is, of course, a very, very major aspect of that, is because of stress. It's just, I'm sure the patients get tired of hearing, doctor, what caused this? And I said, well, have you been a little stressed lately? And they go, well, yeah. The leading cause of back problems is dissatisfaction with your work.
Wow.
They've proven that. They've done questionnaires. What is it that kind of kicks off the whole low back issue? And, if you have back-breaking work, that's kind of where it comes from. Mm-hmm. But, yes, the stresses, the tensions that we actually create in our lives is the leading reason why people seek out chiropractic care.
Well, I like what you said. Chiropractic care isn't just when you're in pain. It's so much more than that. You're affecting the nervous system, affecting people's overall health when their spine is aligned.
Certainly. And it really does actually reduce your biological age by affecting the nervous system and how that's all functioned. We had way back, we had the 8 pillars of perfect health. The number one issue was energy flow. And the main constriction of energy flow is stress. Where we tighten up, get stressed, it will actually cause misalignments into the neck and the spine. Very easy to pick up, and will have a huge effect on one's health and well-being. So being able to get those relieved has a huge effect, and chiropractic is one of the best ways to do that. Most of my patients who come in for chiropractic care say it's amazing how much better I sleep, how much better everything works. Their stress level goes down. I have many. I have several women who sit there and say, "My family asked me to come back to you, and to get realigned."
Isn't it time
I
for
needed,
your
I needed a realignment here, and there is a tremendous amount of truth to that, and it is something that can actually help to maintain a level of health and quality that you normally wouldn't find.
Yeah, I just think about dentistry and how well they've done with the dental health and, people.
For marketing.
For marketing. And, I don't think chiropractic's done the same as dentistry as far as the importance of their spinal health.
Yeah,
spinal
educating
health
people.
is so important.
People used to only go to a dentist when they were in horrible, horrible pain. And that was the only time the dentist got to see them, until they actually taught them that it's best to maintain the teeth than actually coming in when there's a crisis. Same is very, very true of the spine, even more so, and has even a bigger effect on one's health. So looking towards chiropractic as one of the big stress relievers is very important.
Right. Well, let's talk about acupuncture. You're a licensed acupuncturist. We do that in our office along with chiropractic and many other modalities. But how does acupuncture help in living younger?
Acupuncture is a huge stress reliever. I have one of the things I did is I had a law student come in, and he was actually, to help him to study, he had been taking Adderall. And had read online that some people had found that acupuncture actually even worked better. So he wanted to give it a try. We did the acupuncture. He was able to not take his Adderall for his studies. He says it actually even worked better. It had a huge stress release for him, and then also helped him to concentrate much better. And so all of a sudden I had about 4 or 5 law students coming in for acupuncture. But acupuncture is also a huge stress reliever. It's interesting, a lot of people are quite surprised that after I put the needles in, oftentimes they'll fall asleep.
Right. Yeah.
That's a very common type of a response to that. And it does have a huge amount of physiological effects. And again, that's one of the pathways that are very important to actually work with. And getting that energy flow is one of the biggest things that we can do in our office, as opposed to a lot of the different types of clinics, that deal with the overall body. Understanding that and getting those opened up has what I feel is the most important and also the most immediate change in someone's balance and physiology, and getting someone into homeostasis.
Well, and I want our listeners to know the 8 pillars of perfect health. We do usually that show once a year, and it's a 7-week program that we have. And you can listen to any of our past shows. I know a lot of people will download them onto their iPhones and listen to them in the car or when they're exercising, working out. But that is really important. That's kind of the basis of our practice. Our philosophy are these 8 pillars of perfect health. So would really encourage you, if you're a new listener, to get on the Voice of Health radio and listen to those podcasts. Let's go on now, Dr. Prather. We're talking about how to live younger. Oxygenation.
Well, oxygenation, if you were perfectly oxygenated, you would look like you're 21 the rest of your life. So, trying to achieve that is something that everybody would like to have. But it is something that needs to be worked on and actually encouraged. One of the things is how deeply you breathe has a huge effect on that. Oxygenation is very much involved with the cardiovascular system, and that is the number one killer. So understanding and keeping everything perfectly oxygenated is a very important aspect of what we do. We look at how deep people breathe. We can actually measure that with the spirometry. We also check on the anemia of how well that's working. We're looking at blood flow. Do you have the arteries opened up? So oxygenation, how well someone's oxygenated. Aerobic exercise is one of the biggest ways of actually curing low oxygenation. And that is one thing that we actually have some special emphasis on. We have a device called the external counterpulsation. That is an aerobic exercise machine for people, and is something that is used by quite a few pro athletes and Olympic athletes to improve their oxygenation and see the changes that actually occur. And we get some very dramatic changes in people.
Yeah, and we do a thorough evaluation prior to that to look at oxygenation levels through our cardio-assess, because we're not going to put someone on it that doesn't need it. But there are people.
Actually, everybody can benefit from it. But
we all need oxygen.
Actually, everybody needs it. But at what level do they need it? And some people, it's actually in more of a life-threatening type of mode, and because their oxygenation is so low. And one of the things that's very important to understand is you need aerobic exercise for the oxygen to actually be able to get to the heart. If you don't do aerobic exercise, your heart doesn't give it enough oxygenation, and you actually develop a condition called hypoxia to the heart. And that will kick off a whole series of cardiovascular scenarios that oftentimes lead up to a heart attack or congestive heart failure or all sorts of different types of things that can start to occur. And if you can get that reversed, then that has a huge effect and will actually lower your aging process.
I know you just hear so often, he was on the tennis court and,
fell over dead.
We were at a football game this season. One of the refs, just fell over from a heart attack. I mean, how do you prevent that from happening?
Well, and prevention is the main way. First, you have to have a thorough diagnostics on that and keep up on that, especially if you're over 45. Having it once a year done is a critical aspect. Good cardiac workup, and then seeing exactly where you are.
Okay. Never miss an episode of The Voice of Health so that you can stay informed and empowered about your health. Get a podcast of our show automatically delivered to you every week by signing up for our show on iTunes. You can find that link on our website at thevoiceofhealthradio.com. And don't forget, thevoiceofhealthradio.com has complete archives of all of our past episodes with an audio library of information to help you add more life to your years and more years to your life. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice. What conditions can be helped with acupuncture?
The World Health Organization has actually done some definite research. Also, the National Institute of Health has done quite a bit of research on acupuncture with quite a bit of very strong evidence on what it works for and what it doesn't. If we take the digestive area, abdominal pain. I have a lot of people with severe abdominal pain. We can put the needles in. Oftentimes there's immediate results. Constipation or diarrhea, we can get some changes along those lines. The reflux has some very, very good results on that. Emotionally, I have a lot of people coming in for anxiety or depression. Insomnia, I have had patients who were who even after the first treatment that night, they actually were able to sleep. One gal said, I haven't slept in a couple of days, Put the needles in, she fell asleep on the table, and she said, wow. Infertility is a very common type of thing with a lot of research on.
We have a lot of people coming in for
very high success rate for that. But there are very definite points that affect fertility that are very important to know. It's just not that you're going into an acupuncturist, he's randomly putting some needles in. You have to know where those points are, how they're affected, be able to evaluate them, see which ones are off, and how you can actually make an effect on the body to actually increase the fertility rate.
Have you had success with
Getting
infertility?
women pregnant?
Yeah.
I don't know if that's the best way to put it.
Right.
No, very definitely. We have a very high success rate with women with infertility. We have several proud moms who are also coming in for after the birth, just to help to relax because it helped them so much, one, to get pregnant. During the pregnancy, help to control the pain, nausea, all those types of things. And then afterwards, it's a very trying type of time and find that the acupuncture is very helpful at that time. But a very, very good success rate. I'm probably saying it's almost 80%.
Wow.
Which is really, really good. So we're very proud of that and glad to help women in that struggle.
Find out if acupuncture is right for you. Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope.
I'm walking on sunshine. Whoa, I'm walking on sunshine. Whoa, I'm walking on sunshine.
You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where our mission is restoring hope to our patients. We're talking about how to live younger, and you're going to be turning 57.
What?
But biological age, you feel 37. Is that what you said?
Yeah.
Or 35. And I know my dad is he's close to 80, isn't he? And his biological age is more like the early, he's in his early 60s.
Sure.
So that's what we're talking about today. We had finished off with oxygenation and talking about the role of the endocrine system with, youth and the feeling of youth. And first of all, Dr. Prather, I want to make sure, even for myself, what encompasses the endocrine system?
Well, you're talking about the hormones. And the endocrine system is basically pituitary, thyroid, thymus, pancreas, the gonads, uterus, ovaries, all those types of things. So
Us women have a lot of those hormones.
Yeah, much more complicated than males. We're much simpler, as you would agree.
That's true.
And the endocrine system provides the hormones. There are two things that basically tell the body what to do, the nervous system and the endocrine system. And actually, the two work very closely together. And there are definitely hormones of youth. And you can really manipulate people's biological age quite definitely through their hormones. So if you can actually get those balanced up to par, then you actually have putting off quite a bit of the aging process.
So how do you do that at the Prather Wellness Center?
Well, of course, we do different types of lab tests to determine where someone is deficient, and then we actually have many different means of actually changing the hormones of the system. We have some from pharmaceuticals to homeopathy, to herbal remedies, through organotherapies. That's actually thyroid or a pituitary, taking that orally. and then having the body actually rebuild it. So we have a lot of different ways to actually work with it, and it is actually quite a complicated type of process, but it has huge benefits for people because very few people are actually totally balanced in their hormones. Mm-hmm. That's a rather unusual finding. Most people have started the process of a lot of the aging where their hormones aren't working up to par, and that actually accounts for a lot of the disturbances that people feel.
Mm-hmm.
So
it's hormone-based.
Hormone-based. So looking at that, getting that well evaluated, and then starting the process of getting that balanced out through the multiple ways of actually working with it. We probably have more ways to do it than almost any place in the country of actually approaching that and seeing the results plays a huge role in people's health and well-being.
So how can the endocrine system be improved?
The endocrine system can be improved. Of course, one of the first places we start is the thyroid. Mm-hmm. So many people are off on that, and we're actually not just looking at the drastic numbers, but actually some of the smaller numbers. We also look at the sex hormones, estrogen, progesterone, testosterone. There's actually 64 different hormones that we can actually test out and then actually manipulate. Mm-hmm. One of the nice ways that we have of actually working with it that is a low-risk, easy way to do it is homeopathy. Homeopathy actually makes excellent changes, very low risk on that. It actually will balance it whether it goes high or low, and then it actually helps the body to achieve that homeostasis that we're always talking about.
And I know, you're not giving out specific like homeopathic here on the radio because
it
everybody
has to be
comes
tested.
in and, yeah.
It really needs to be tested to find out which way. And the best way is the most important part is thorough lab testing. Mm-hmm. And that's through blood work, urinalysis. There are many different means of actually testing it, or even a combination of ways to find out exactly where it's off. Anytime, of course, women are going through menopause, it's very important to keep that balanced and they don't go through the hot flashes and all the other things. We have excellent results along those lines. It's actually very important for weight loss, any type of obesity problems. Needs to, first, the endocrine system needs to be looked at and balanced out. Any type of sleep disturbances, depression. Mm-hmm. They found through studies that 70% of everyone who has depression issues, it's actually endocrine related.
Wow.
So
yeah, the endocrine system is very important.
Very important also for prevention of many types of cancer. Mm-hmm. Prostate cancer, breast cancer, ovarian cancer. All of those are related to abnormalities within the endocrine system. And if you can get those balanced out, then that will actually prevent those. Mm-hmm. For anyone who's been through those different types of cancers, keeping the endocrine system balanced is an important way of actually doing it. And one of the things is that oftentimes pharmaceuticals can actually play a role in making that worse. So having alternatives to those pharmaceuticals is very important.
Okay. Well, one thing that's probably very important, diet and exercise, the roles they play, in living younger.
Yeah, if you want to have the full extent of your life, having a proper diet is extremely important. And looking at and evaluating that and making sure that people are correct on their diets is a huge part. 60% of all cancers are related to diet. Cardiovascular disease, obesity, type 2 diabetes has a huge effect on dietary types of understanding. And we actually get into it much more deeper on diet. What are the food allergies that you have? We get into the whole digestive tract. What's involved with that is your pancreatic enzymes working up to par. So
if you're breaking down.
If you're actually, digesting. So just looking at the digestive system, at the diet that's associated with that, very, very huge type of a undertaking and has some very complex types of tests that we can do to see exactly what is going on with someone's diet and how that can be improved. The American diet is full of chemicals. It is imbalanced in the way that it goes. We have way too much sugar, way too little fiber. We need to eat in a much more natural type of way. One of the things is shopping around the edges of the grocery store is probably one of the better types of things, and through the middle is where you get the processed types of foods.
You've always talked about, eating like a king for breakfast, a queen for lunch, and a pauper for dinner. It was really hard to break down, any type of, like the red meat and after 3 p.m.
There are actually different times that you should be eating that can play a big role in your health and well-being. My grandfather was a farmer, and their biggest meal of the day was breakfast, which is actually a much more in the, what I would say, in the natural world, is a better way to eat. So big breakfast, medium lunch, and then a small supper is the best way to do it. And of course, here in America, that's completely opposite of what we do.
We're eating late.
We're eating later.
Eating standing up.
Right. There are an awful lot of things that have a role in diet, but diet can certainly play a very, very huge aspect in our health and well-being.
Okay, we talked about the role of exercise.
Yes.
You always say exercise
cures a world of sins. And if you have regular exercise, that is one thing that you need. Aerobic exercise, resistance exercise, flexibility, muscle balancing, kinesthetic types of exercises all play a very big role in our health and well-being, and should become an important portion of what we do. Again, it's something that's done and balanced. People can overdo. But like anything, it is finding that balance for each individual and actually achieving that.
What about, you hear a lot about free radicals or antioxidants. What's the theory behind them and helping with aging?
There is the theory of free radical pathology is a big process of aging. One of the things, if you see those, what they call liver spots on people, those are a sign of free radical pathology. Cataracts, macular degeneration are all involved in free radicals. Free radicals are during the oxygenation process of our body. If things don't go smoothly, then a free radical is actually released from the oxygens and go out through the body and cause damage. One of the natural antioxidants that we produce in our body is cholesterol. So one of the things is if you have high free radicals in your system, then your cholesterol level will actually raise. And there's different blood tests that can indicate free radical pathology. And if that is going on, that will make you tired, run down, and increase your aging process. Matter of fact, that's the smoking is a huge thing that actually kicks up free radical pathology. Gut dysbiosis causes free radical pathology, and something that needs to be looked into. And looking at the antioxidants, that's anti-free radicals, that's what they're talking about, that as a portion of keeping the aging process down is an important aspect.
You talked a little bit, too, about the gut, the role the gut plays in the immune system.
Yes, the gut is where 80% of your immune system is. And if you have problems with your gut, that's one of the leading causes of autoimmune diseases, which is a big scourge in people's lives. Diabetes is an autoimmune disease. Cancer, actually, I would consider an autoimmune disease. Sjorgensen's, all the different types of thyroids, from Graves' disease to Hashimoto's, all those different types of things. But if you can get the gut working right, then the immune system's going to work right in the whole system.
Well, thank you, Dr. Prather. We're out of time already.
Already?
I know, on how to live younger. The Prather practice is located at 8902 North Meridian Street on the north side of Indianapolis, just south of the I-465 loop. If we can help you to achieve better health, we'd love to hear from you. Connect with our office at 317-848-8048. That's 317-848-8048. Join us again here next week or anytime on our website at thevoiceofhealthradio.com for The Voice of Health with Dr. Robert Prather. Are you frustrated by not getting to the root cause of your health issue? Are you tired of not knowing why you're always fatigued? Are you wanting to say no to toxic drugs? Have you lost hope? Are you just tired of being sick and tired? At the Prather Practice, we want you to know that we have the answers for you. We offer the alternative to the disease care model. We are the drug-free model to health and wellness. At the Prather Practice, we look for the underlying cause of your health problem and not just the symptomatology. Through thorough diagnostics, we find your individual health blueprint for your treatment. Where the disease care model is symptom-based, the structure-function model we practice gets to the root of your health issue. The Prather Practice is the most comprehensive wellness center in the Midwest. Our integrated practice offers you the most treatment options to restore your health and your hope. Learn more about the Prather Practice by calling 317-848-8048 or learn more on our website at thevoiceofhealthradio.com.